All right, I'm going to demonstrate the sugar tong splint here. Actually, this is called the reverse sugar tong, and I'll describe the two of them for you. Now, the measurement will be taking a 3-inch elastic bandage, place the wrist in the middle of it. If you see a 1/4 to 1/2 inch on both sides, 3 is fine. If not, you size up to 4. Your length will be, now, conventionally, we all know the measurement goes behind the elbow up to the palmar crease, so the MCPs are free. That's conventional. That's okay. The one I'm going to show you now is the reverse sugar tong. Measurements behind the elbow to the PIP joint. A little bit longer. Now the reason I'm going to do this is because conventionally we have some problems with it. And I find on the bottom here you have pressure on the elbow and the ulnar nerve. Also I find that on this technique the patients tend to extend their elbow and they slide off the splint. Especially some of your larger elbows. No elbows at all actually. Okay. And I also find out when you're wrapping distal to proximal with this technique here, the splint tends to fall down. You may come down here with extra material down here, and what do? You end up folding it, putting more pressure on the ulnar nerve. So let's eliminate those negatives, and I'm going to show you the reverse sugar tong. It's a little bit different. So get that measurement to the PIP joint, pull this out from the end, cut it off. Push the product back into the foil, into the box, bring the door down to your feel it, bring your fingers out and remove and make sure that red line is gone. You have a nice seal. Slides right out of your foil. Come over to your towel, and on these edges make sure you protect the patient from this fiberglass. Again, grab both ends at the same time, stretch, open, just find the middle and just walk your scissors through, and right to this point. Now you can feel the fiberglass ends right here, so just feel where it is and just bring the tips of the scissors back right to the fiberglass, okay, and snip. Now the reason I say this, because if you go all the way through like this, you will cut it all the way in half, okay. So now once you cut it, now I have one splint and not two, because see how it's still attached here? But I created these fiberglass edges. So protect the patient from this fiberglass. Just stretch, turn, stretch. Same on this side. Stretch, turn, and stretch. And that protects the patient from any abrasive edges. Now I also like to do with this splint is on this side, the double face tape side, open that up. Expose the fiberglass just right here in the corner and just remove the fiberglass, just this corner, maybe the length of the thumb. Just take that corner right away. Remove some of the excess padding, but leave your hinge. Again, this is all protected. Okay, now I'm going to wet this, and again minimal water down the middle, one side here and there. Sandwich this and fold, fold, squeeze, push that water through, and then open it back up on your towel and remove the excess moisture. Just rolling it down. Squeeze, put on the dry side of the towel, do that a second time, and again you're just removing the excess moisture from the padding, so it shouldn't be dripping. Okay, and remember to pad any bony prominence, which is the ulnar styloid on this particular injury. We're going to loosely pad this. 3-4 wraps will be fine. I come to the hand one time, and that's all I use. Now taking my splint, now instead of coming from the bottom up here, conventionally, reverse it. Come from the top down. See how that frees up your hands? Gravity helps me here. Now lock it in at the wrist like normally, just to capture my splint. Okay. Now see, remember I measured to the PIP. Now I dropped it to the MCPs so they can flex to all 4 fingers. Come through the wedge space. See that cutout I made for the thumb? The thumb is free. Come around the back of the hand, down around the wrist and coming back towards the elbow. Now make sure your splint goes more towards the radial side. Sometimes your arm's dropping and the splint comes more on the lateral side. Make sure it goes more towards the medial side. 50-50 coverage. It will normally take 2 bandages to do this. First one will stop short of the elbow, properly applied. Now again, just lock that in. In the second bandage, I tend to use a 4-inch bandage. Once, twice. Now, to eliminate all those problems we had down here at the elbow, on the nerve, on the bony prominence, take the medial side first, pull towards the shoulder, come off the elbow and the ulnar nerve. Really come right off the ulnar nerve. Okay? And now grabbing this bandage and this splint on this side, pull towards the shoulder. Underneath, once that's captured, take your left hand off and come around and capture your splint. Okay, 90 at the elbow. You're off the elbow and the ulnar nerve totally. And now just cover the elbow up with the bandage with a series of figure 8s. Okay, and again, palm of your hand, smooth it out, center to the side, center to the side, back it up, other side. MCPs are free, thumb is free, elbow totally free. Place them in a sling across the chest, above, I'm going to come down here, above the heart. Okay, so place them in an arm sling, across the chest, above the heart, in a sling. That's the reverse sugar tong.